I think we're going to get started. Oh, yes. Mohammed, we're going to answer that question for you just in a few minutes here. So bear with us while I introduce everybody and then we will get this party started. Thank you so much. Good evening, everybody. My name is Bonnie Gardner, and I am the Vice President of Student Enrollment and Financial Services for CBBC Career College. And it is my absolute pleasure to be here with everybody tonight. With me, I have our lovely and talented dental instructor, Kayla Miller.
Hi guys.
And Dr. Ron Chafe, dentist, who helps us out in our school with our students.
Mhm.
Well, I was hoping there'd be one more guest. They may just be a little bit late arriving, so hopefully they'll be here shortly. What we wanted to talk about tonight was the shortages for healthcare professionals in the province of Nova Scotia. We understand from many, many articles that have been produced in the last 2 years and from a group called Action for Nova Scotia that there are many shortages across the province in all healthcare roles. Obviously, Dr. Chafe and Kayla are here to talk about dental and the need for dental assistance in not just the province of Nova Scotia, but across the eastern provinces. And then I've done a little research on medical lab and on some of the other programs that are really, really needed in Nova Scotia province. So I've got an opening statement for you that I think you might find very interesting. Today, I went on to the Nova Scotia Health Authority career page. And I looked to see how many open positions they had in the province of Nova Scotia. The number is 12,000. 12,000 open positions for qualified healthcare professionals. It's an astounding number. 196 of those positions were for people in medical administration. That would be our medical office, unit clerk, ward clerk, admin assistants. Then we had our continuing care assistants, which we have a fabulous free program in Nova Scotia to ensure that students can be trained and work in the field as a continuing care assistant. Then we had our medical lab assistants. Of the 12,000 open positions, almost half were medical lab assistants. It was shocking to see those numbers. Kayla, can you give me a sense? What is the future of dental assistants in the province of Nova Scotia right now?
So for Nova Scotia, and I'm sure Ron can kind of touch on this as well, dental assistants are in extremely high demand, not in just Nova Scotia, but really Canada-wide, I want to say. The new program that ran out last year that started for giving people free dental plans and things like that has just put an extra pressure on what was already a shortage anyway. So now we have more of a shortage. There is something I've been noticing. I've done the same thing, Bonnie. So I've gone on and kind of done my research as well. If you look at like the Government of Canada's job bank, it shows that the opportunities for dental assistants right now are the highest that they've ever been, but they actually expect it to grow, if not double, within the next 2 to 3 years. And that is because a lot of the assistants who are working right now are kind of getting close to retirement age. More dentists are coming up because dental is becoming a bigger thing. There's more students coming out as dentists, so more offices and clinics are opening. But also, we live in a province where there is a higher elderly age group as well, and that is something that kind of wears on dentistry. So we have a really high population of an older age group, which is something that just comes with time. We are almost in crisis mode for dental assistants at this point. I get calls every single day from somewhere in the province. I had one today in Dartmouth and one from Bedford, and that was just today, just begging if we have anybody we can send to them because they're so desperate. So really, it's in high demand right now, and it actually looks like it's just going to continue to
Trending.
increase if we don't do something soon.
And that's definitely the impression I got
Yeah.
from even some of the government pages. I read a statement from your premier in Nova Scotia, and
Yep.
he talked about really working towards a better healthcare system within the province and the
Yeah.
aging population.
Yeah.
Dr. Chafe, tell me a
Sure.
little bit about your view on the need for dental assistance right now in the province. Do you see any gaps anywhere in what's happening with dental assistant training?
I don't see a gap with the training per se, although dentistry is progressing from a technical standpoint a lot more rapidly with cone beam scanning, 3D imaging, and things like that that may not have been taught even years ago. And I think the demand for more technical skills is there, and a lot of that can be learned in office. But I'm not sure if the program is supplying that right now. As far as rural, I called our dental association yesterday because it was short notice for this, and they weren't really in a position to give me any information on. But Kayla was really up on what she just said. But I do know from my own experience, rural areas are in high need for licensed dental assistants. They're really in demand. I know of some offices in particular. Without giving names or anything, that would take them right away if they could. She touched on another things that graduating more dentists all the time, especially with the advent of corporate dentistry. Dentistry has become a very expensive business to get involved in as an individual. But with the expansion of corporate dentistry, a lot of these dentists are getting out and getting in established practices that have big patient loads already. And dental core, that would be a prime example. That's a nationwide program. My general experience or impression, without looking up facts to that nature, in which Kayla did, is that there are still many dentists out there looking for licensed dental assistants, that the positions are available for employment, should those people, be available. I can see the future, as Kayla said, with the national dental program is going to bring a lot more people to dentistry. This is new, and it's going to bring a lot more patients into office. So the demand in offices is going to be higher than it has been. So if there's any kind of need now, it's going to be even greater, not worse. I think I can say that with reasonable certainty. How's that sound?
And certainly, during my research in the last few days, one of the things I have read repeatedly is the need for help within our rural communities,
Absolutely.
across the board in healthcare, dental, medical lab, medical office, doctors, nurses, CCAs, which is, of course, our continuing care assistants. It just appears that more and more people want to be in or need to be in that rural setting to help us in the healthcare system.
And it is harder to get them to go because with a program like, I know it's online as well, but my familiarities with Dalhousie and classmates of mine in dental hygiene, they want to stay in the city. A lot of people come in from New Brunswick, PEI, Newfoundland, and they're there for 4 years. And there's a lot of opportunities in the city that gobbles them up. So there's always been a demand for rural professional people that are trained and licensed in those fields. And I can see that just not getting any less demand, but even more demand based on the number of dentists coming out, and the national program is going to bring thousands of people to dentists that were never going before. So I can just see the demand is continuing to increase. How's that sound?
Yeah, no, absolutely. Kayla, I know that at CBBC College, we're trying very hard to help bridge that gap for dental assistants. We've got 2 classes every year that are running. Can you give me a little bit of information on our dental assistant distance program, the program that we're hoping will help bridge a little bit of that gap into the rural settings?
Absolutely. We are super lucky. We have been one of the first ones approved for the online dental assistant program, which allows you to do your school from anywhere. So if you're in a rural area, then you are able to hop on Zoom with me or one of my other team instructor there, and do most of your actual learning online. You do 2 days a week in an office, so you still get all that hands-on experience. And then you travel up to Sydney 3 times during your course for 1 week and then 2 different stints of 2 weeks. You come up and we do all your hands-on training. So it is something that I have taught in class, I've taught online. I honestly think that the online program is going to really just do amazing once we get going. We're only in the first couple of years now, and now dental assistants are an extremely high demand. I would love for us to kind of expand on that and hopefully even have to add more classes because the need for assistance is there. So we are able to do that. You have amazing training. I have not had a student in any of my classes that has finished without a job offer. You not most of the time, halfway through your schooling, if you've done a placement somewhere and you've been a good fit, they're going to give you an offer before you're even close to graduation. And that just shows you how high demand we are right now, that they're trying to grab them up before they even get out of school so that they know they have that assistant at the end. So online is amazing. It's working really, really well. Our students are excelling in the online programs. I'm amazed at some of their progress throughout the year. And it's because they have 2 days a week in an office working at a dental clinic. And then you get to come with us and practice all your hands-on and then go back and do them every week for 2 days. So it's working out amazing. I'm seeing some people ask some questions. So I just want to make
I am
sure.
too. There's lots of questions coming in.
So which courses are free in healthcare in Nova Scotia? I'll let you answer that one, Bonnie.
Yeah, so there's one free course in Nova Scotia that is free at this time, and that is the CCA Continuing Care Assistant. It is only free until the end of this year. So we do take classes of 24 pretty much every month for CCA across the province of Nova Scotia. We teach virtually and train hands-on. So lots and lots of opportunities for that. It is a free program funded by the province of Nova Scotia. The other program that is being sort of funded right now, but not completely, is the Community Support Worker Program. I read today that there is a brand new division of the government in Nova Scotia who is looking after addictions and mental health. They have started several new facilities to help with addictions and mental health. COVID gave us many, many things, good and bad. Unfortunately, one of the things COVID has left us with is some serious mental health and anxiety issues. The government of Nova Scotia has recognized that and is increasing their ability to help with addictions and community service. And so they have asked for us to get 10 students to start this fall in a community support worker program, and each of those students will be given a $5,000 bursary. So we are actively recruiting into our community service worker program right now for our Sydney campus. There is a huge demand. We are very confident all 10 will be hired right at the very beginning of our program. So unfortunately, there was only 10 bursaries, but we're confident that if we can prove that these 10 bursaries are used and that they're hired, that we will hopefully get some more. So those are the opportunities paid for. The CCA program is not free for international students. International students are not considered residents of Nova Scotia, so they do have to pay for the program. Residents of Nova Scotia are given the CCA Continuing Care Program free of charge. My wife has taken admissions and her class will start October. We already applied for government loans. Is there any way to get some financial assistance or support from the college or province? And is she able to distance learn sometimes? Mohammed, you would have to let me know what program your wife is going into for me to be able to clearly answer that question. How much for international students for CCA? I believe it's around $13,000. That's all of your training, all of your certifications, and your practicum. You have to do a practicum in a long-term care and in community. So I believe the program is 18 months long at $13,000. And Mohammed, if you can let me know what program your wife is going into October, I'll be happy to answer your question. Tell me about what a dental assistant does in a dental office, Dr. Schaaf.
Ooh, put me on the spot.
That's my thing.
Well, my understanding, there is a license requirement to do certain procedures that you're not able to do without that certification. And they, in my recollection, would be to take intraoral, that's in the mouth, x-rays or radiographs, dental impressions, things that require the assistant, whether they're certified or not, to putting things in the mouth. The other one would be polishing teeth. They're trained to polish teeth and licensed to do that as well. Not scaling, that's scraping the tartar, but polishing is something assistants can do. Applying fluoride. What else? They do assist the dentist with their procedures, with suction, with holding instruments, passing instruments, sterilization as well. Like there's everything the dentist doesn't do, which is a lot. The dental assistant does, and they're very well trained to do that. There are some things, not many, that would help a dentist if somebody came in that wasn't a licensed assistant, that they would be able to do. So the program really certifies them in the necessary procedures to do it. And we're all taught four-handed dentistry, and that's the dentist has two and the assistant has two. And most of the procedures we do require four-handed dentistry, which is a licensed dentist and a licensed assistant. So it's specifically, there are radiographs, impressions, things like that, sterilizing that are done by a licensed professional. Does that help you at all?
Yeah, that's perfect. Thank
and
you
also
so
too,
much.
just as a follow-up, with technology today, a lot of dentists are getting into 3D imaging, scanning, milling, and people can be trained in those aspects as well. And a lot of that's being done by dental assistants today as well in certain offices. So the profession is definitely expanding and having a wider scope from just the basic things that we're used to. How's that sound? Sound good?
Yep, that's absolutely wonderful. Thank you so much.
I see some questions coming in, so I'm just gonna answer. I can't answer the CSW, the community port.
So let's see if we've got, so can we apply for CCA for September? So September is, I believe, almost full. So if you are looking to apply for September as an international student, I would highly recommend getting hold of the campus either in Sydney or Dartmouth right away. I did do a check this morning, and I think our next available class is October, but please do check. If I take a free community support worker course, is there a condition like I have to work for 2 years in Nova Scotia? So the course, Joanne, there's a $5,000 bursary for the course. It's not completely free. There is $5,000 given back to you by the government. There is no condition on that. But I do expect that if you were to take the program, you would be hired very quickly within your own community to be part of the community support workers and the increasing need for addictions and community support in our province. This one I'm going to pass on to you, Kayla. It says, is dental assistant same as hygienist? And what would be the fees for an international student? So I'll get fees. You talk about hygienist.
Yeah, I was going to say, you handle that part. So a dental assistant, is it the same as a hygienist? No. So what I always say to people who aren't really sure what an assistant is think of it as the nurse for a doctor. It's basically kind of the same feel. So we aren't working separately cleaning teeth all day. We work with the dentist chair side, helping them with their patients for the day. So if you ask me, I think assisting is really interesting because it's different every day. You're seeing different people, you're doing different procedures. You could be taking impressions, you could be doing tooth whitening, you could go create something in the lab. So there is so many things that you can do as an assistant. And also to kind of elaborate on what Ron was speaking about before for like how dental assistants work in an office, it's really about efficiency as well. So something for dentists, you are running a clinic. It is a business. You want things to be running smoothly. And if you don't have someone to sterilize your equipment in between or wipe down your rooms even, that is going to slow you down. But if you are able to do four-handed dentistry, see double the amount of patients, it really makes the dentist's life a lot easier. Your job is, like I said, helping them with their patients and doing whatever they need you to do, which can change day to day, which is one of the main reasons I love this job so much. It's never the same. It's always something different. And I'll let you handle the fees.
Can I
I'm working
follow
on the
that up?
fees right now.
Can I follow
Please
that up a
do.
bit?
Of
Yes,
course you
Kayla?
please.
can.
Just to be a point to her question, where a dental hygienist can work independently in the province now and see their own patients and take care of them on their own. And
Yeah.
that's totally different from what an assistant does, just
Yeah.
to throw that in there.
Hygienists are just the ones who clean your teeth. So if you go to a dental office for a checkup, they clean your teeth. The assistant is the one, if you have a filling, the person who's sitting across from the dentist helping them. So that is the difference.
Go ahead, sorry, that's good.
No, that's it.
I was just going to jump in. And for years, a dental hygienist in Nova Scotia had to work in the presence of a dentist. That's changed. Where I am in Camp now, we have an independent practice of a hygienist. She has her own spot. She has her own chair, her own thing. She does cleanings. There's no dentist involved in that. So if an independent practice in the healthcare is something you're interested in, a hygienist may be able to do that. But the dentist assistant is with an office, a team. You're part of a team.
You're part of a team, exactly.
Got it. Okay, just to clarify what the two are. Okay.
I actually heard just recently in the province of Alberta, there is a mobile dental hygienist. So you can make appointments with this mobile hygienist and she will travel community to community.
I worked with one of actually the girl who started that in Alberta when I worked out in Fort Mac years ago. But it's really cool because it's not only in Alberta. We now have them in Halifax. And awesome. They actually hired one of my students. So now one of my assistants works in a mobile hygiene clinic, and she travels around to places like senior citizen homes or places that maybe if there is a home where people aren't able to leave their house or leave their facility, they can come out to the van, get their teeth cleaned. The assistant takes the x-rays get sent to the dentist checks them, and as long as there's nothing major, it's just kind of when they're not able to get to an office, but it's really amazing and super helpful for patients that aren't able to travel far.
She is so busy that it's completely out of control. It's so amazing.
I said Camp and Inverness and Sydney and Nova Scotia and those rural areas could really use those, and they always need assistance too because they need the help and support. So.
And as for the cost for international students to dental assistant, it looks around the $21,000 mark. I have brought one of my fabulous admissions advisors into the webinar for us. So they'll be able to help us with some of those questions. You won't be able to hear her. She'll just be typing responses online. And I've also added the fabulously talented Greg Cole. Greg is one of our career and employment specialists in Nova Scotia, and we're going to ask him some questions shortly about what he's seeing as needs in some of the fields that we've been talking about. How long is the dental assistant course, Kayla?
It depends. If you are looking to do our online and our in-class are a little bit different, and it's only because of the hours. So online runs 50 weeks. It's 8:30 in the morning till 3 o'clock when you're in class with me. And then 2 days a week, you work a shift at the dental office. So 50 weeks. For in class, it runs at about 39 to 40 weeks, depending how holidays and things like that work out. But you're in class from 8:30 till 5. So your days are a little bit longer. Works out to about the same hours. So under a year, either program that you're in, you're going to be finished and you're going to be working before the end of the year.
Less than a year.
Less than a year.
Cannot miss that opportunity.
No.
So for Stephen Mills, and I remember your first name, I think is Allison. Allison, we just added a new October CCA, but I think it was for Dartmouth, not Sydney. So you may be correct that the next available CCA is for January. Can you please talk about the nurse needs? That's a little bit more difficult for us, Caesar. We don't do any courses for nurses. We do our continuing care assistants. But as part of what I was researching today, there is an outstanding need for nurses in the province of Nova Scotia. Really, from what I read, every healthcare professional from doctors, nurses, continuing care assistants, medical and dental. We desperately need all of them in the province of Nova Scotia at this time. So I hope that really helped. Over in our Q&A board, there's also a whole bunch of questions. So let's see what we have in here. Beatrice asks, could we advise on the academic calendar and requirements for admissions? Beatrice, can you just give me an idea of whether there's a actual, specific program that you're looking at? And Tasha, who's in the background here, will be happy to type the answer for you. I studied medical lab in Syria, but I was not able to bring my certificate or my high school certificate. What is the solution in this case? And again, I'm going to ask Tasha to take care of that for us. Thank you, Tasha. Tuition for CCA for international students, that's around the $12,000 mark, Pearl. Fees for dental assistant, so 18.5 for domestic and around 21 for international. Is the CCA program 8 or 18? It is 8. CCA program is 8 months. I studied medical law, done that one. How long is the online dental system program? They're both less than 1 year. And when do classes start? January. Online dental assistant starts in January 2025. We only take 18 students, and I believe we already have 7, so not a whole lot of spots left. Can I do LPN in Nova Scotia? So again, we do not at this time do anything with nursing. I do know there is a massive shortage of nurses in the province. You would have to reach out to a college that facilitates nursing training to be able to effectively answer that question. So I think we got a lot of those done. Thank you, everybody, for that. Greg, thank you for joining us. I'm hoping that you'll be able to speak a little bit to the need for medical lab assistance in the province of Nova Scotia. I know at the campus that you run your career and services from, which is our Dartmouth campus, we have a fabulous MLA program. Can you talk a little bit about practicums and getting our students hired from the medical lab assistant program?
Yeah, absolutely. One of the roles of career services is making sure that when the students graduate, they're, career ready, they're out ready to go do a job search and whatnot. And with the MLA program, I've always joked with some of our colleagues, it makes my job so easy because literally, I think the last stat we looked at was about 97% of them were hired before they graduated. Primarily through either Nova Scotia Health Authority and or the IWK. The job demand is so high, and we often actually see those two employers posting job ads for medical lab assistants in training positions, which is their way of getting students in, working for them before they graduate, knowing that they can then retain them after they graduate. The demand is so high that we're literally not putting out enough to fill the need. They're graduating, they're going out, they're being employed. It's fantastic.
Awesome. That's what I've heard. I know that the government of Nova Scotia has approached us about doing some rural training for medical lab assistants. We have some practicums in some of our rural settings in Nova Scotia, so that we can hopefully try and get as many new medical lab assistants certified as possible. Kayla, can you speak to the certification for dental assistants? Do they do the NDEAB exam?
Yeah, so we are really lucky. We are completely certified this course. So instead of having to do 2 exams, which is like a practical hands-on exam and then a written exam at the end of the course, you only have to do the written board exam. So it's a National Dental Assistant Exam Board. Our stats this year, I think, are like 97% have passed out of our last classes for this board exam. So we have really, really good results for that. So what you do is you do the course. At the end of the course, your teacher or instructor, which will most likely be me or my colleague Amanda, will help you sign up and register for this board exam. It is something that you write post-graduation, so it's usually within a month or so Could be a week, could be a month, depending on the time of that board exam. You write that board exam. Once that exam is written, then you can register for your license. Whatever province you are in is where you register for. This national board exam allows you to work all over Canada. So if you live in Nova Scotia, you register in Nova Scotia, but maybe 5 years down the line, you decide, hey, I want to move to Alberta. You just register in Alberta. You have all the qualifications that are needed to work anywhere within Canada. So it's really, this course is awesome. There's no questioning. You know that you're good to work anywhere in Canada. You get to write that board exam, and you are completely registered as a level 2 dental assistant at the end.
Thank you, Kayla. I see that one of our guests has applied for the September 2024 CCA program. That's amazing. Again, as part of my research today, it is still one of the top in-demand roles in the province. With our aging population, everybody needs CCAs right now. One of the things that's happening in the rural settings in Nova Scotia is a program called Grow Your Own. This means that long-term cares are finding employees that they would like to hire and then sending them to our program to be trained so that they can work in the long-term care in a rural setting. So we have places like Melville, Dykeland, Inverness. They're all doing rural training for CCAs to ensure that we can fulfill the demand for this massive need in the province of Nova Scotia. Greg, we have a distance program for our medical office ward clerk. Can you tell me a little bit about what that looks like?
Yeah, it's something relatively new. However, it does really allow, and what we're seeing with the students who are coming on board, it really does allow students from a wide range of locations across the province to come into the program. The bulk of it is online, as you mentioned, and their placements then, as opposed to when we used to offer it, or still do offer it, on campus, what we're seeing now is students having an opportunity to take the course from the comfort of their home, but also to find placements in their communities so that they can actually add the value back in when they graduate. And the response to that has been very positive since we started doing it.
Awesome. Thank you so much. Again, when I looked on the Nova Scotia Health Authority website today, 196 administrative positions in the province of Nova Scotia. Those are our medical office, those are our support, our admin assistants, so many open positions right now. We are in a healthcare professional crisis in the province of Nova Scotia. We got a few more questions that are coming in. Just let me see if there's anything new here. How long is the online dental? We did that one. We did this one. LPN, we unfortunately cannot answer. We did this one. Okay, I think we're on track with our questions, which is awesome. Kayla, can you tell me what I need? How do I get into the dental assistant program?
So it's a pretty easy one too, and Tasha can kind of go over any requirements on her kind of aspect. But for us, you do need things as well as most healthcare programs. You will need your vaccines up to date, TB testing done, CPR, which now I teach as well. So that is something that we can include in your schooling. So you don't have to pay for that out of pocket. I can do your CPR and your oxygen training with you when you come to campus for your training. Other than that, Tasha, I know you know more of a list of exactly what's needed for the dental assistant program for requirements to get in. I know you need a science, I believe in grade 11 or grade 12, and you need to have your academic math. But we are always kind of open to, if you went to school maybe in a different country or a different province as well, we are willing to kind of see where you're at and we can go from there.
And Tasha, maybe you could put the admissions requirements into the chat box and just put it to everybody. So anyone interested in the dental assistant program would be able to see those requirements. Kayla, I promised her she wouldn't have to speak.
Oh, okay. Sorry, Tasha.
Yeah.
You can type it in the chat. But yeah, she knows more about that. Tasha's the one who deals with all of our intakes for dental assisting. So she's kind of the pro at the requirements. I just say, Tasha, is everything good? And she goes, yep, everything's good. And we go, perfect. So as long as you're willing to get your vaccines, which like I said, is mostly like your TB and your hepatitis, that's the main requirements for us. And most of the other things we can get done while you're here.
I can also speak out just because it'll be probably easier than typing it all. So the requirements for our dental assistant program will require our students to have grade 12 or a GED. We will require students to have an integrated science 10, as well as either biology or chemistry of grade 11 and higher. So integrated science 10 or the biology or chemistry of grade 11 and higher. With an academic grade 12 is a requirement as well. Students will need to pass a criminal record check with a vulnerable sector search with no criminal convictions or charges. And the biggest part with this program, especially the distance program, we will help you look for sponsoring dentists, as that's a major aspect, as well as taking our distance program.
And a question did come in, and this is an interesting one, Kayla. Maybe Dr. Chafe, you could help us with this. So can any subject credits be transferred from a degree? I did a Bachelor of Science in Biology, so I know anatomy is a main subject for most healthcare programs. In dental, would we do any kind of credit from a Bachelor of Science in Biology?
I don't believe we would. And that's solely because our anatomy, what you would have done in your Bachelor of Science for biology is probably, I mean, you would know the background and you'd have a great idea and a great start. Ours goes into more so regarding teeth, nerves, and we're worried about nerves that run to your teeth. So everything is kind of focused in one more area and we deep dive into that. So it's not just a bio course that we do in our dental assisting program. Bio is spread throughout a lot of it. So it's not just one section that we do and then we move out of bio and we go into something else. Biology is just something that is part of the human body and the makeup. So it's really throughout the whole program. So it would be hard to just take a credit and put it into that because, like I said, it's not just one bio course that we do. The biology background that you would have would be amazing, though, and really help you out throughout the course because you'd have a great background in it.
Absolutely. Absolutely. Greg, we've talked a lot this evening about the need for healthcare professionals in the province of Nova Scotia, specifically medical lab, dental assistant, medical office. Our job at CBBC Career College is to ensure that students come in, get their diploma, and are hired in the field that they got their diploma in. Can you speak a little bit about how we ensure that our students get a great practicum experience and that we can help them get that final stamp on the diploma that says they're hired in their field?
Absolutely, yeah. So, I mean, on the practicum side, depending on the program, the process works a little bit differently. With MLAs, where we really have one major partner, being the Nova Scotia Health Authority, we have a good relationship with them. We let them know where the students would prefer to go. And as much as we can, we try to match them up with those preferences. The health authority has the final decision at that point, but we certainly try our best. And with medical office assistant, it's really a collaborative process between career services and the student, beginning even within the first couple of weeks of their program, when I would go in and meet with the class and have a little chat and talk to them about where they'd like to go. Is it at the health authority, to be working, doing their placement as a ward clerk, or is it more in a doctor's office, in a clinic? And then based on that, it's the same kind of a conversation. Where would you like to go? What are you looking for? And then we start, sourcing out either from some established partners that we have, or in a lot of cases, it might be a brand new communication with someone we've never put a student in before. But we do our best to try to make sure that the location and the experience that they have really kind of meets what they're looking for, both in the short term of their placement, but also in the long term of if it's somewhere they might want to look for employment after they graduate. So, that gets them through their placement, which is at the very end of their program. And then if again, especially for MLA, the majority of our students do seem to get hired out of their placements, although that's not a guarantee. If they don't, we tend to reach out in career services, usually within the first week after graduation, or their program end date, just to ask them that question. Are you working? And if you're not, do you need some help? And if they are working, then that's fantastic. We just, congratulate them and say, reach out if you need anything. But for those few that aren't, then we start a minimum bi-weekly series of touch points with them to see, how's your resume and cover letter? Have we looked at that? Can we fine tune it any? What about interviews? Are you getting interviews? And if you are, how do you feel about them? Do you need some one-on-one coaching, some role play with it? And we actually will track the student that way over the course of a couple of years, not just to make sure that they get their first employment, but also to make sure that if they decide for whatever reason to go looking for their second or their third or their 12th, career move, then that we're there to support them for that as well.
Awesome. Thank you, Greg. So we've talked a lot today about a variety of healthcare programs and the incredible need for healthcare professionals in the province of Nova Scotia. Let me just quote that number to you one more time. On the Nova Scotia Health Authority website for job opportunities today, 12,000 open positions for healthcare professionals. That is a large number that is needed in the province of Nova Scotia. At CBBC College, we do the dental assistant program, the medical lab assistant program, medical office assistant, and our fabulous continuing care assistant. Currently, the province of Nova Scotia does provide funding for domestic students to take the continuing care assistant program free of charge. There is a charge for international students. And there is a fabulous new bursary for our community service worker students. We are only taking 10 students into the program in October of this year. There's only a few spots left, and the students taking the CSW program will be given a $5,000 bursary. All of these programs have practicums and an opportunity for you as a student to put all of your theory skills into practice in a hands-on setting. Can I have more details about the office assistant program, the length, tuition requirements, and what would be expected? That is a fabulous question. Tasha, if you're still with me, I know I promised you wouldn't have to speak, but I'm breaking my promise. Can you give us some details on the office assistant program, length, tuition requirements? That would be fabulous.
Sure. So our medical office and ward clerk program runs a total of 42 weeks. It is an online program with classes running 4 days weekly, Monday to Thursday. The requirements are a grade 12. We don't require the students to have any science backgrounds along those aspects, as we will be training you in class. And the total cost for tuition, it's on the top of my head, but it's just a little over $14,000. This is your tuition as well as your books. And we also reimburse our students with the distance program for their first aid and CPR as well.
Awesome. Thank you. And I'm thinking that we're also being asked for some information about prerequisites for the community support worker program, length of program as well. Please, Tasha, thank you.
Our community support worker program runs approximately 28 weeks. The requirements will have our students having a grade 12 or a GED. If you're over the age of 21 and we do not meet those, we can do what we call an alternate admissions test. The requirements will also need you to pass a criminal record check with a vulnerable sector search being clear, as well as a child abuse registry check being clear as well.
Awesome. Thank you, Tasha. We are coming to the end of our webinar today. I want to thank each and every one of my guests. Kayla, thank you so much for joining us and giving us some fabulous information on the dental program.
Of course,
Dr.
I could
Chafe,
talk dental all day, and so could Dr. Chafe, I'm
I
sure.
know. Thank you both for
That was
being
fun.
here
Thank you.
and sharing your passion with us for the dental assistance program. I know that in the province of Nova Scotia, anyone working in healthcare is a hero, is someone that we respect and applaud for the work that they do. And obviously, we need a whole lot more heroes in our healthcare field. Greg, thank you for being here and thank you for jumping in last minute. I'm so incredibly grateful. And Tasha, we could not do this without a fabulous person from admissions joining us on the webinar. Thank you so much. I'm going to leave you with a closing thought from the Minister for Healthcare of Nova Scotia. Recruiting and retraining and retaining healthcare professionals in the continuing care assistant, medical office assistant, dental assistant, nurses, and medical lab assistants is one of the most pressing issues facing healthcare in Nova Scotia today. I encourage you all to think about where you'd like to go in the next year to a year and a half, and whether being a healthcare professional is truly something that's in your blood. Please reach out to us at CBBC Career College. I'm happy to provide Tasha's or my email so that you can continue to ask questions, book appointments, check in with us. We have programs starting on a very regular basis. Our next dental start is our distance start in January. There might be a spot left for September in Sydney in person, but the rest is our distance program in January. Our MOA program is November and our community support worker program is October. And I can't believe I remembered that off the top of my head. Medical lab assistant is October and January, and we truly want to see you all come to school, achieve your goals, and be the best healthcare worker you can be in Nova Scotia. Thank you, everybody, for your time and energy tonight. Please take lots of care. Bye-bye.